So this WCC 2024, I talked about our project in Côte d'Ivoire Cancer Center. Actually, this is the first comprehensive cancer center in Côte d'Ivoire. So we are trying to our best in making a good cancer center in Côte d'Ivoire, also in entire Africa. So we talked about the project in the podium that actually Korea is a poorest country in the world in 1950s, but we developed our economy, and since 1980s we started helping others, but the result is not so good because we build many good hospitals around the world, but they usually failed because they don't have a good ability to maintain the hospitals or cancer centers made by Korea. So we thought the way that we have to make education and training before the cancer hospital, and after hospital open, we have to follow up and guide the hospital. So this is the first trial of Korean government and entire Korea to make a pre-training and post-follow-up pattern of the hospital. So Samsung Corporation makes the entire plan, and we participated at the education and training and follow-up guide of the new cancer center in Côte d'Ivoire. So actually, to make the better country with the cancer control, the National Cancer Control Program is important. So for the National Cancer Control Program, the Comprehensive Cancer Center is also important because the good cancer control program requires many great personnel of the surgery, physicians and pathologists, radiologists, and radiation oncologists, and also epidemiologists, and also statisticians. Everybody is important, but usually we cannot gather together this expertise. So making a good cancer center, we can gather together every good brains to one place and make a good plan. So we hope that this our first comprehensive national cancer center in Côte d'Ivoire will make a good cancer control plan in Côte d'Ivoire and make a healthy country in Africa. Yes, this was the first thought in the about 6 or 7 years ago, but it is planned, and the government supplied and the contract was made in the 2021. The contract was the Department of Health and Hygiene in Côte d'Ivoire and Samsung Corporation. The money is supported by the Korean government, but the Côte d'Ivoire government opened the chance to make a good cancer center. So Samsung Corporation was selected, and NCC Korea was a member of this consortium of Samsung Corporation. So it started in the 2021, and the building of the cancer center was started in 2022. But at the time, there was a problem that the land has so many water. So if you dig the land, the water comes out. So actually, we changed a little bit. So the building is now nearly made up. And next year, next summer, maybe we have a good cancer center in Côte d'Ivoire. Yes, but the other problem is that the language. As you know, Korea is influenced by the United States a little bit, and so we are familiar with the English, but not familiar with the French. But actually, when I was young, many Koreans learn German and French as a third language. But nowadays in Korea, German and French is not a good third language, maybe Chinese and Japanese. So the language was one of another problem, but we recruited many good French-speaking expertise in Korea. So we have 10 or 20 good French speakers and interpreters in the NTC Korea. So we are also from that point, we are also another project for the Francophone African countries about the same project or others. Actually, we are planning many projects in the Middle East, Asia, and also the Russian-speaking countries, including Afghanistan, Uzbekistan, also in Ukraine. So, but in these days, this project, this area is not a good candidate for our work. So we changed a little bit to the Africa and even to the South America. So we are planning another project in the Francophone African countries and also the South American countries. So we hope that we want to share our experience from the poor country to the middle level or high level country. We can share our expertise, experience, and knowledge to them. So that's my hope for the world. Yeah, one thing is that we are planning. We planned the Côte d'Ivoire Cancer Center, and we are in the middle of the course, entire course. But 2026, we finally opened the cancer center in Côte d'Ivoire. But the importance is the after that 2027, 2028. So many people, many countries can build a hospital, but that hospital cannot go where easily. So we are also trying our best to make a good, sustainable, and equitable condition of the cancer center in Côte d'Ivoire. So I hope everybody in the world look at Côte d'Ivoire that the cancer center is going well or not.